Happy morning, everyone. I'm Dr. Meghna Mukhund, CEO and Director of Mangalore Heartscan Foundation. 29th of September is celebrated as World Heart Day. And you all know that routine exercises does impact heart health. But are you doing the right amount of exercise? Are you doing the correct kind of exercise? Or if you've been diagnosed with heart disease recently and you're wishing to start exercising, to know about all this and more, we have with us fitness coach, Mr. Abhiram Nair. Hi Abhiram, good morning.
Hi Meghna, how are you?
I'm good. So Abhiram, my first question to you is there a difference between being fit and being healthy?
Oh yes, there's a lot of difference. So a lot of people, they have a misconception that you look fit, you look healthy, right? But what exactly it means? So to put it simple, fit is nothing but you being able to do your daily routine and your chores on a regular basis without any difficulties.
Okay.
And healthy is something more specific. So it's more like there are certain criteria, like say your blood pressure levels, your glucose levels, and if you have cholesterol, right?
Yeah.
So there are certain thresholds for that. So if you come into that category and if you if you tick all the boxes, it means that you're a healthy person. But so that's the difference.
I might look unfit, but I might be healthy, and vice versa with you.
Yeah,
you look fit, you might be unhealthy.
Exactly. So you never know.
Yeah.
That's when people who are fit, they take themselves as for granted sometimes, right?
Yeah.
That's why we see a lot of people who look fit, them getting myocardial infarction
Right.
and heart attacks.
Sudden heart attacks. Yeah.
So that's when we recommend people who look fit that they have to start
undergo
exercising
tests.
and work out. Exactly, tests. So the tests do determine that how healthy you are, right?
Perfect.
So I would say that's how the difference is.
Yeah, okay. Also, I would like to know, is there a particular kind of exercise that would benefit heart health? Such as some people like walking, like we are seeing a lot of people here who are walking, but some people like to do strength training.
Exactly.
And some people swear by endurance exercises.
Exactly.
So do you recommend one type of exercise for heart health?
So I would say as far as you're moving, as far as you're active, be it any exercise that you do.
Yeah.
So it can be cycling, swimming, walking, right? And some HIIT is a big hit now because people are realizing how important it is. So it mainly focuses on getting your heart rates up, right?
Okay.
So how can you make your heart healthy is increasing the heart rate.
Right. I've heard that it's important to incorporate strength training to keep your heart healthy. What is your opinion on that, Abhiram?
Yeah, so strength training, if you're asking me how it's related to heart health, is that, say coming to you, right? For women especially, like we discussed before, that they tend to have less lean muscle mass.
Yeah.
And there is a criteria known as VO2.
Okay.
So it's nothing but your ability to intake maximal oxygen when you're doing high intensity workouts, right? So it also depends on how much muscle mass you have. So if you have good muscle mass, which comes with strength training, you will have a better heart health.
Yeah.
That's how it's related.
And I also know that an additional advantage is that you prevent injuries.
Exactly.
Right?
Yeah. So you prevent injuries, and also how injuries happen is like lack of mobility, lack of flexibility.
Yeah.
And coming again to women, specifically, women who are above 40 years of age tend to lose bone density, right? And I would recommend any women out there that, they start strength training above 40, right? And it could be women who are 50 now or 60 now, because it's never late, right?
Yeah. How often should they be in a week?
So I would say from the American College of Sports Medicine, its studies have done, and it's recommended that they do 150 minutes in a week. That's more like 30 minutes a day.
So that is the overall time that you should spend in exercising.
Exactly.
So when it comes to strength training, out of 150 minutes, how much is recommended?
Yeah, so like I said, it can be a mix of that, right? So strength training, if you're asking specifically, I would say at least thrice in a week is recommended.
Thrice a week?
Yeah.
Okay.
That's really good. So.
And what about intensity? So you said 150 minutes a week.
Yeah.
So let's say somebody is walking.
Yeah.
How much is good?
Okay.
As in, like, as it should be mild or moderate or?
Yeah,
high
so
intensity?
intensity also matters at what fitness level you are in.
Right.
Fitness level, again, it means that if you are a sedentary person, then I would say you have to start with your walking. You can start with small jogging, and there are things like cycling and swimming, right?
Yeah.
And you yourself can control the intensity. For example, we are in the park right now,
Yeah.
and the one whole round is 800 meters, right?
Yeah.
So if you get tired after one whole round, then you know where you stand, right?
Yeah.
So I would say that's more like a moderate intensity for you.
Okay.
Again, if you take extra one round, that's high intensity, right?
Yeah.
So what you can do is you will understand where you stand, and then you
Okay.
have to keep repeating that.
So we should define what is mild and moderate for us.
Yeah.
And then what is recommended for heart health? Is it
Yeah.
mild? I mean, of course, we should start
Yeah.
mild, but is it okay to go to moderate level and to high intensity?
It's always progressive, so it goes from light to high. So light, I would say, taking an example of the spark, maybe half a round of the spark is light intensity for you,
Okay.
and one round is moderate, and 2 rounds could be high intensity.
But with respect to heart health,
Yeah.
I have seen that American Heart Association, like you said, does recommend 150 minutes a week.
Yeah.
But they do recommend that you do moderate amount of intensity
Yeah.
for heart health.
Yeah.
So this much prevents heart disease is what is said in American Heart Association.
So moderate intensity, why they have mentioned is because it's a level where your heart goes to on a higher benchmark, right?
Right.
So the main reason also, the heart gets only healthier if it goes on a higher benchmark, right? You have to challenge your heart, right? Because the light intensity will not challenge your heart.
Right.
It could still be in that range where you
Okay.
work in your, maybe in the hospital or something, right?
Right.
So other than that,
Yeah.
if you like do moderate activity, that's when your heart goes up, right? And then if it gets used to it, that's when your heart gets healthier.
Accustomed to it.
Exactly.
And you know that your heart has become healthier.
Exactly.
Right?
Yeah.
So we do recommend that you do 150 minutes of workout in a week.
Yeah.
And start slow and aim for moderate intensity.
Exactly.
And when we say moderate intensity, it probably means that you are slightly breathless and you can speak in sentences.
Absolutely.
Right?
Yeah.
Yeah.
So when it comes to that, how you find yourself, if you're the only person, right? And if there's no one to monitor if you have gone high or moderate, right? So
Yeah.
something called RPE
Okay.
that we use. It's called rate of perceived exertion.
Right.
So we have a
RPE.
scale. Yeah. So
Okay.
we have a scale from 1 to 10.
Okay.
Right. So for example, from 10 to 7 is where if you're breathless and if you're not able to speak, that's when you stand in that range.
Yeah.
And then below that is when if you're able to speak and you're breathless, so you can put yourself in that, right? So that's a great tool.
Right. So if someone has had heart disease
Yeah.
and they want to reach a moderate level, so you're saying it's good for them to know their RPE?
No, so RP is just a way of measuring where you stand, right? Like how we measure
Yeah.
our weight,
Exactly.
right? So it just helps us understand where we stand.
So and you're also able to know if it's too much for you. If
Exactly.
you're going an RP level of 7 to 10, that
Exactly.
probably would be too much.
Exactly, because sorry to cut you off, but
Yeah.
so there are a couple of ways where you can read yourself where you stand, right? So an easier way of understanding where you stand with respect to if you're tired or if you cannot go further, if you don't want to overexert, is
Yeah.
checking your heart rate.
Heart rate,
right?
yeah.
So that's how you do it. Is like you measure your heart rate, keep checking your pulse over here.
Or we have a smart watch.
Exactly. People who don't have access to that,
Yeah.
they can absolutely check through that, right?
So is there a target heart rate that we should be achieving during exercise, or should we have a heart rate targeted exercise plan?
Yeah, so I would say, again, according to the studies from the American Heart Association, is that a person should train until that 50 to 80% of maximum heart rate.
So Abhiram, we were talking about maximum heart rate.
Yeah.
So how do I know what is my maximum heart rate?
It's a simple formula.
Okay.
So maximum heart rate is nothing but 220 minus your age. So if you
Okay.
are 50, so it's 220 minus 50. So that's your maximum heart rate.
Do I look 50? No, right?
No,
Okay.
you're not 50.
So if maximum heart rate is 220 minus 50,
Yeah.
and that would be probably
170.
170.
Yeah.
So do we target 170 when we're doing high intensity workouts?
Not at all.
No?
170 is more like the benchmark. So it lets you know what's your limit. right?
Okay.
So I would say 50 to 80% of 170 is where you have to target.
So we start slow at 50% of
Exactly.
maximum heart rate, and then we go up to
Definitely,
80%.
yeah. So it can, starting with walking to you doing HIIT, right? So HIIT will definitely take your heart rate to 80%, right?
Abhiram, so what about people who have had stenting or
Yeah.
their heart is not pumping to the maximum because of a diseased heart? What is a good exercise plan if they want to start after, of course, they are on treatment
Yeah.
and they want to initiate some amount of physical activity? What is a good plan for them to
Yeah,
begin with?
so coming to the plan, I would say for example, if there's a patient that comes to me, again, before that, they have to take consent from the physician.
From the physician,
Right? So once they're clear from that, me as a trainer would give them a plan. So if I am giving a plan to a person who has undergone stenting, who have blockage or heart disease, I would say 2 to 3 days to max a week, for a week. I would see how it goes for them, starting with walking, mild walking, maybe inside the house and maybe in the lawn, right? And depending on how they give response to that, depending on the feedback, I will increase the intensity. And increasing the intensity, it cannot be drastic. So it can be maybe if they are walking 2 rounds of their lawn, I would say maybe you can increase it by 1 or 2 rounds extra. And it also depends on how confident they are, right? So it can then, if they come and ask that, okay, I want to increase or I want to maybe do a different thing as I'm walking. So I would say cycling is very safe. Yeah,
so
because it's stationary.
Stationary
Exactly.
biking.
And then the next level would be swimming, right?
Okay.
And if in case they want to challenge themselves more, and it can vary from person to person. Some people recovery level is
depending on their
really
recovery,
high, right?
you would increase the intensity.
Yeah. And if they want to start strength training, I would say they have to consult that physician, right? Then I can make a plan for them, starting from low intensity to moderate intensity and so on. So that's how you progress.
Yeah. So we keep our physician informed about this all the time.
At all times, yeah.
And then talk to our trainer regarding our targets.
Yeah, so 2 main people that you always have to get in touch with, because you never know. Right? Sometimes you may take things for granted and
sometimes
take it
you may
lightly.
be doing too much.
Exactly. You may get overexcited with the amount of confidence you have. It's always to go safe.
And what about people who have mobility limitations? Let's say a lady has knee pain. So other than swimming, what would you recommend that?
So I would say stationary workouts, exercises. So cycling is the best. That's been found out with researchers.
So compared to treadmill walking or walking,
cycling is the best. And basic walking, I would say, like inside the house, and just try not to sit for a very long time.
Sitting,
not being sedentary. That's the word.
Get up and get moving.
Just be active.
Okay, that's excellent, and we've known a lot about how to keep our heart healthy, Abhiram. Thank you so much from Mangalore Heartscan Foundation to Abhiram Nair and to Abhiram.